I mean, I hope the discussion and, Ralph's lived experience shows how important mutation testing is in terms of risk stratification, in terms of diagnosis, and in terms increasingly of identifying the best treatment. Just in that context want to say that applies not just to trial treatments, but it increasingly applies to standard of care. If you have a FLT3 mutation, you should have a FLT3 inhibitor with intensive chemotherapy. That there are different mutational testings methodologies available for AML. And it's very important when we're thinking about different methodologies about the question we're asking. More sophistication doesn't necessarily help if the questions that need answering are quite simple. And finally, I think it is this spirit that we talked about with Gail just now. And, I think the wonderful example of how Gail and Ralph and his family had this lengthy phone conversation about what was the best treatment for Ralph. Physicians really do want to engage with patients. We are your servants. And I think an open conversation in which patients can identify concerns they have, ask questions that don't make sense, and perhaps using those discussions move towards the best treatment for patients is important. And it's for that reason that I think in the clinical trial context, we would be discussing options with patients, but then encouraging patients to go home for a few days, write down any questions they have, and then think about moving forward.